Hi, and welcome to your medical terminology course. This concerns chapter 1, or Introduction to Medical Terminology. And this is week 2 of your course. We're going to dive into what a medical assistant does. And let's take a look. So, medical terminology is the language used to precisely describe the human body, its organs, functions, components, conditions, disease processes, and then we can go into medical procedures as well. So it is quite literally a common language that we as healthcare workers can use to give the patient the best care possible and all work together. Learning these terms can help improve communication, which is a huge factor in whether or not a patient has a positive experience and gets the care they need, and understanding in healthcare settings. Okay, so the book kind of starts with word parts. It dives into prefixes, word roots, and suffixes. As with every other class, it's extremely important to read the textbook, whether you have a physical copy or the ebook, doesn't matter. Make sure you give it a read. That's really important and will help a lot. So let's take a look at this concept in order. We can start with prefix. That's the beginning of a word, often indicating things like location, time, number, or quantity, or amount. So let's take a look at an example. Hyper. Now, most likely in life, you've probably heard this in some context. For example, my almost 9-year-old son is pretty hyper, but that just means he has a lot of energy. But if you saw this in a medical word, maybe hypertrophy, it would mean maybe excessive growth or something's getting a little too large, larger than normal, let's say. Then there's a word root. It's the main part of the word and usually refers to the body part. In this example, we have cardi, and that means heart. Now, I want to take a break real fast and say and emphasize that the word root and the combining form are different, but they're very close, like they look almost alike. For example, cardi, as we established as a word root, as soon as you add this /o, you have a combining form. It's the word root with a vowel added at the end. All right, and then suffix. This is the end of the word, usually indicates like a procedure, a lot of the time condition or disease. For example, itis. So if we have gastritis, gastra is the word root, Gastr, and that means stomach. If we add itis at the end, that's us telling another healthcare worker that this patient has pain or inflammation in the stomach, gastritis. So some common suffixes and their meanings: algia for pain. There's one example here. Another one might be neuralgia. I've heard that one a lot in my career. The beginning, Neur, refers to the nerve, and then algia is pain, so we just have nerve pain. Synthesis is the surgical puncture. Abdominocentesis, seen this quite a bit. Ectomy is surgical removal. Appendectomy, pretty common to have to do, remove the appendix. Itis, seen that. There's that example I used before. Rhea and Raphi. So common prefixes and their meanings. And here I've given an example. Remember, we're taking on the role of an MA in the weeks 2, 3, and 4, just to give you some insight into what they do and how they might use medical terminology. So right here, she's taking a patient history and she's trying to give the next person who will care for this patient the best information possible. So she's using medical terms. Hypo, it would be our prefix. Gaster, right here, that's our word root for stomach, and ick. So it's kind of giving a location, hypogastric, or below the stomach. All right, so hyper, saw that one before. Hypo, that's what we're seeing here. Deficient, it can also mean below or under, you might say. But hypotension, this is like low blood pressure, for example. Pre is before, dis is difficult or painful. Dysplasia is our example here. And then supra and super, these are used in different ways, but mostly just mean above. Supracostal, for example. So body systems and procedures. Gastroenteritis is inflammation of the stomach and intestines. So now we're kind of combining word roots, but you can see we have our combining form here, right? Gaster up to the R is our word root, but we have our O combining form there. Angiography, imaging of the blood vessels. We'll get into X-ray, CT, MRI, stuff like that in weeks 5, 6, and 7, and you'll really need to know about angiography, colostomy, surgical opening of the colon, and then intramuscular. So the better you get with breaking down these words, the more you can figure out exactly what the other person is saying, without even maybe having heard that exact word before. But you know the prefix, the word root, and the suffix, put them all together, and you have your answer. All right, so she's kind of, in this case, this MA is taking this patient's vitals, but she's also kind of interviewing him some more. She's asking about a diagnosis he got. And this is an example of a medical term. If we break this down, we can kind of know exactly what she's talking about. Hepatomegaly, enlarged liver, cyanosis. You'll see in the textbook, they break some word roots and combining forms down that indicate color. This is one of them. Cyan or cyano, remember, word root or the combining form. It refers to blue. Arteriosclerosis, hardening of the arteries. So here we have word root artery, combining form as the O there, and sclerosis is hardening. Myopathy and mycosis. All right, signs, symptoms, and syndromes. A symptom is what the patient feels. It's something we can't quite measure. So if I tell you my head hurts, that's a symptom, right? That's what I feel. But as a healthcare worker, we can't really test that. I mean, I guess we could get a CT of the brain and see if there's something that we can actually see in there, but we cannot measure the pain. Oh, we have to go by what the patient tells us. Sign is something we can measure. So blood pressure, temperature, things like that. A syndrome is a group of symptoms. Remission is when symptoms decrease or disappear. You hear this a lot in cancer treatments. And then prognosis is the predicted outcome. If somebody asks what their prognosis is, they're asking what is likely to happen. So when every second counts, even every person in a healthcare team has a responsibility to care for any patient that comes in, no matter who they are, even people who are there for like maintenance or to clean the area, janitorial services, things like that. We all have a duty to the patient and we're all important. So triage, prioritizing patients based on severity. So these are just more medical terms too. Sorry, I got off on a tangent there, but you'll find these in the textbook. Triage, for example. Laceration, you as an MA, you may see a laceration come in and you're going to have to gauge whether or not that patient needs to go in right away. Or to an emergency room if that's not where you are already. Anyway, a torn wound, trauma, severe injury, hemorrhage. We saw reg earlier in the this ending here, RRHAGE. We saw that suffix earlier in the presentation, I believe. If not, here it is. It's excessive bleeding, suppuration, the formation of pus. All right. Careful, and this is the final slide. I'll try and keep this short, but I do want to emphasize, be very careful of look-like and sound-alike terms and word parts. For example, palpation and palpitation. So palpation is going to be when you kind of feel for something. So we use this a lot in X-ray when we're trying to find the exact spot to center our X-ray beam over. We palpate different areas of the body to try and get, a good spot to put the center of the X-ray beam. On the other hand, palpitation is a pounding or racing heart. Very similar words, but they are completely different things. A nurse may palpate the abdomen of a child to see if maybe they have an obstruction or, something like that. Laceration and lesion, these are also very similar. Fissure, fistula, And then, of course, these prefixes here, I'm glad the textbook kind of pointed these out because they can get a little confusing after a while. They're all so similar. So just wanted to point that out. And we are at the end. Thank you so much for listening.